Okay, welcome back to the EPT Documentation Orientation Lecture Series. This is part 2, and we hope that you enjoyed the first part. In our first module, we talked about the chart serving several functions.
Those functions include communication, medical, legal, financial, and regulatory. And today we want to discuss key elements of the chart with you. So again, a lot of this is going to be review. Most of this was covered in your medical school and probably in your residency. And again, those of you coming to us from other jobs, probably learned this a lot, in their regular, their prior jobs as well. But the elements of the chart, the key elements of the chart, obviously include history and physical. And in EPT, we follow sort of a modified history and physical format.
We'll talk about that later. But the history part starts with the HPI, and that is, we'll talk more about the HPI in an upcoming module, but that's where you really briefly let whoever's looking at the chart know why the patient's there and what the concerns are. The second area that you'll see under history is the past medical, family, social history. Those elements of the chart in our medical record, which is EPIC, can be populated by anyone.
Exactly.
So that if a nurse or another provider has put that in the record sometime in the past, whether it was the same day or a year ago, that information exists in the chart and it gets automatically pulled into your record. So you can review that. You don't even necessarily need to type that information out or re-enter it because often it's there. By the same token, if you find out additional information or if those elements have never been pre-populated, you can populate them, and that will live in that patient's record, not only in your ED record, but also outside that. So anybody else that looks at that chart or is doing their own H&P, it'll be pulled into their record.
And then the other area of the history that's important, especially from a financial standpoint, is the review of systems. And again, we're going to cover that in a later
Exactly,
module.
what the rules are behind that.
The second big element of the chart is the physical exam. And then the most important element of the chart, in my opinion, is the medical decision-making and the ED course, the disposition and diagnosis. And in our EMR, we've actually modified would be the right word. We've modified the H&P format a little bit to something called an APSO format, meaning that most people that look at the chart after we've seen the patient you're talking about consultants, you're talking about admitting physicians, you're talking about primary care physicians. They don't really care as much about what comes in the history and HPI. They more care about what was our assessment and what did we do to manage the patient. And so we put that right up front. We put diagnosis first and then assessment plan.
Right. So if you're familiar with the SOAP format, subjective, objective, assessment, and plan, in our format it's assessment, plan, and then the subjective and objective. So you're going to have a diagnosis. What did you think the patient was wrong with them? The plan is really the ED course. What happened in the emergency department, what you did, why you did it, and then follow up. And then following that in the way the record reads, you'll have the HPI and the review of systems and the physical exam, which most readers is less important.
So I like to think of it as kind of an HPI combined with a discharge summary.
Exactly.
So we're going to talk very briefly about some financial implications and give you a little bit of a background with how charts in the emergency department are coded. And first and foremost, it's important to recognize that the elements of the chart determine the reimbursement. A lot of my partners are under the mistaken impression that what we ultimately diagnose the patient with actually determines the amount that we can charge, but that's not true. It's actually what determines how much we charge is what elements we've documented in the chart.
Right. For example, if you had a patient with bad chest pain, but you have a very poorly documented chart, you're going to get paid very little, even if the patient's having a heart attack.
Right.
And if you have a patient that's there for a suture removal, no matter what you document in the chart, you're only going to get paid, let's say, much because it is a suture removal and there's very little medical decision making. So there are rules to follow and best practices, and we're going to try to make them as simple as possible, so you don't really need to worry about specifics. You just need to understand that complicated patients are complicated, need a more comprehensive chart, and simple complaints need a simple chart.
Now, in the world of emergency medicine billing and coding, there's basically two types of codes, I guess I can say it that way. There's an evaluation and management code, and then
E&M.
there's procedure codes. About 80% of the group's revenues come from E&M codes, and 20% are going to come from procedure codes. And
So procedures are like if you do a laceration repair, an ultrasound, put a central line in,
Exactly.
pass an NG tube, even do critical care. There's some things that you may not
Exactly.
think of as a procedure that are procedures.
Exactly.
And there are 5 E&M codes. Level 1 would be the most simple, and level 5 would be the most comprehensive of the
Right.
emergency evaluation and management codes. Not the emergency medicine codes.
It should be emergency medicine.
It should
codes,
be,
though.
but they're emergency medicine evaluation and management
Exactly.
codes.
So again, it's the amount of work. It's not actually the diagnosis that drives how we bill and we code.
And so you have to document the work.
Exactly. So hopefully that was a good review of some of the elements of the chart and then why they are important. In the next module, we are going to take a deep dive into the history section and give you some tips and tricks with that. And obviously, if you have questions or comments or concerns, please shoot me an email or shoot Tom an email, and we will try to address them. And we'll see you next time.